Hi, this is Priyanshu, currently studying BSc in Trauma and Emergency from Assam Medical College. So today we will discuss about a complex topic, that is head trauma. I will try to cover it in a simple way. It is the most common cause of mortality following trauma. In head trauma, we will discuss mainly three fractures. First one is anterior cranial fossa fracture, next is middle cranial fossa fracture, and third one is posterior cranial fossa fracture. In anterior cranial fossa fracture, cribriform plate fracture might happen. So if we see the clinical features, there is raccoon eyes. Patient has raccoon eyes, raccoon or black eyes due to subaponeurotic bleeding. And the next clinical feature is CSF rhinorrhea. CSF rhinorrhea is a rare condition where fluid surrounding the brain and spinal cord leaks into the nose or sinuses. So the next clinical feature is epistaxis. Epistaxis is bleeding from nose. So the next clinical feature is frontal lobe contusions. So this is all about anterior cranial fossa fracture. Now come to the middle cranial fossa fracture. So it is fracture of the petrous part of the temporal bone, and here clinical feature is Battle sign. Battle sign means discoloration or bruising over mastoid process. And another clinical feature is hemotympanum, that is CSF otorrhea. Here the fluid is fluid that's surrounding the brain and spinal cord is comes out or leaks out into the ear. So it is hemotympanum. And the next is paradoxical rhinorrhea. Paradoxical rhinorrhea is a condition where the fluid leaks opposite to the nostril where the injury is causing, and another clinical feature is facial nerve injury. So this is about middle cranial fossa fracture. So the last is posterior cranial fossa fracture. So here it is very simple. Occipital bone is fractured and there is 6 cranial nerve, that is abducens nerve is involved. So the management for all three fractures, we can prescribe prophylactic antibiotics, and the investigation of choice is NCCT, that is non-contrast CT scan of head. So this is all about head trauma. So in the next video we will try to cover brain injury.